What's up, everyone? My name is Mike Wren. I'm a new faculty attending at Baylor in family medicine. Today, I wanted to talk to you guys about the American Board of Family Medicine certification exam, or AKA the boards, and just give some tips and tricks so you guys can do your best. All right. So, like I said, I'm Mike. I work with MST, Med School Tutors. Who we are, we do a lot of, and I mean a lot, over 15 years of experience in one-on-one personalized online tutoring. And all of the tutors are basically like me, residents, attendings, fellows who have done well on our exams, and we love to meet new people and teach them and help them succeed. Some of the things we'll cover today is just a brief overview of the Family Medicine Board exam, what you can expect, what the test is like, why you need to take the test, some study and timeline tips. I assume that most of the people are watching are in residency, some interns, PGY2s, 3s, hopefully not 4s, and for some people who are trying to recertify. Some other things that we'll cover is when you can find the time to study during residency, or if you're already working and you're recertifying, when to find the time to study, what resources to use. If you go on Amazon or Google, there's a whole bunch, a bucket list of resources, and that can be overwhelming. So we're here to just kind of talk about the ones that you can use that will be most beneficial and the most bang for your buck. And then the last thing is to kind of use the ITEs or in-training exams that you get in residency, use those as a guide to kind of hone your studying. And then, of course, last but not least is the live Q&A. But again, feel free to ask any questions you want before the end. So what's the exam? Well, the exam is given twice by the ABFM, the board that kind of gives you the certification in family medicine. All of these specialties have it. Internal medicine, all the surgical subspecialties, peds, they all have it. It's just a different acronym, different name. But the exam is given twice yearly. You can register for it in November or in April, and I think that extends to the first week of May. The exam is pretty typical. You know, at this point, you've all taken step 1, 2, maybe 3. But it's 4 sets of 75 multiple choice questions. So 300 questions total. Yeah, 300 questions. And you're getting 95 minutes per section with a rolling break time. So you get about a minute 20, a minute and a half per question, and the rolling break time I didn't put on here, but it's 100 minutes. So you get over an hour and a half, and the rolling just means you can take as many breaks as you want with a lot of time. So you can take a 5-minute break, and then you can take a 50-minute break for lunch or something, and then come back and do a bunch of shorter ones. Just some other statistics with this. The pass-fail rate last year was pretty good for first-time test takers. However, for the repeat test takers, the rate is a little bit lower. So, you know, if you know that you're not so strong with standardized tests, or you get a lot of testing or performance anxiety, that's something good to know about yourself. So that way you can prepare for it. And the whole point of taking this exam in the first place is that it's necessary to get your board certification. So you go see your primary care doctor, and they'll have a placard or something on the wall that says that they're board certified. So you definitely want that. So kind of the first topic that we'll talk about is the timeline, when you should be studying. And it's very different from probably most of the other tests you've taken in med school, even though, you know, it's standardized tests, multiple choice questions, yada, yada. However, you're most likely studying for this exam in residency. And residency, especially intern year, you guys watching who are interns, second years, and have been through it, know that it's really, really busy. In med school, you're giving a lot of dedicated time. I mean, you're literally in school. So you're giving a lot of time to study for exams like this. But in residency, most of your time is going to be put towards working and learning the clinical side of medicine, how to work and be in a team, things like that. You'll be busy with rotations. Some are going to be worse than others, maybe some off-service rotations. Like for me, emergency medicine was really busy. So all that's to say, it's not going to be like med school. And there may be some other obligations. Maybe some of you out there have, pets, families, young children, siblings or parents to take care of. So you may not have all the time that you want to study, but that's okay, because having a good study plan and having this timeline will help you. One thing that was a good tip that helped me is that you need to start prepping for your boards early. You don't want to wait for the last few months of residency, because you might get called in for something. I know, especially in the past year, it was really hectic just with COVID. People were getting pulled left and right to cover ICUs, to cover wards. You just never know. So it's best to start early, and we'll kind of talk about what resources to use when you're studying early. But you want to pick a handful, probably 2 or 3, 1 or 2 Qbanks, and then a book. The best time to kind of focus your studying, I would say, is end of 2nd year, beginning of 3rd year, depending on how much you need. That's going to be based on your ITEs, and the best resources to use we'll kind of go over. There's 2. You can type them in the chat, or you can just keep them in the back of your head, which ones you think the best are. And I'll go ahead and tell you and share with you the 2 that I think are best. So generally, when do you start studying? It all starts on day 1 of residency. And it can be something very, very simple, like just reading about a particular patient case or something you found interesting. I remember when I started as an intern, we had this really interesting infectious disease case that I definitely read about, and I still remember it to this day. Another thing that you can start is the AAFP multiple choice questions. If you just Google AAFP board review, and you have to make a login, but again, it's all free. And you'll get, I think it's 100+ sets of 10 multiple choice questions that mirror and are very, very similar to the ITE and the board exam questions. It's clinical vignette with 5 answer choices. There's 3, there's a bunch of them. A good way to get started is just to do 5 or 10 questions. You can start with 5 or 10 questions a week and then ramp it up. Trust me, you won't run out. There's so many of them. Something else to keep in note is that generally in residency, at least in my experience and in the students that I've worked with, they get their residency schedule at least 6 months. If not, they have it for the whole year. So you can kind of see, and this is something where you can talk to like your upper levels or your other classmates about, or even any mentors that you have in that residency, just to see kind of what your chiller months are, and then really tailor your study plan to kind of focus your studying in those months. Some of those can be electives, outpatient clinics, and off-service rotations that are easier in your residency, and then you can really take advantage of that to study. Get us just a sip of water and we can keep moving forward. One thing that everyone is so used to using are question banks. I know for myself, and in the with the students that I work with, we mostly just do Qbanks. It's probably 90% Qbanks and then 10%. Maybe if you're a little bit more old school and you want a book. The Qbanks that I think are the best, well, the one singular best one is UWorld. And there's a few reasons for this. One of them is that you can filter, excuse me, you can filter by the topic. So let's say you know that you're really weak in cardiology and pulmonology, but you're really strong for whatever reason in endocrine. Well, you can filter out those questions and you can specifically do questions for cardiology and pulmonology. That way you can get your knowledge up to date. The AAFP Qbank is also great. That one's free, but again, you just kind of get a random set of questions. The ABFM, they have it's called knowledge self-assessments. It's a set of 60 questions. Those I say are the worst because they're really lengthy, and the explanations are just not as great. And you're reading like 2 pages of explanation for one question. It's just not the best use of your time. But if you've already finished, if you're a champ and you've already finished these 2, then you can go ahead and do the ABFM questions. And honestly, you would expect those to be a little bit better because they're the people who make the exam, but who knows? One big tip I would say to use for UWorld is when you receive your ITE, your in-training exam and residency, there is kind of a breakdown, and maybe at the end of this, I can log in and show you. But there's kind of a breakdown of all the questions. So for instance, if you had 200 questions on your test, maybe 12 of them were cardiology, and maybe you got 5 of those right. So, you know, that tells you that there's a good amount of cardiology questions. You're missing more than half of them. You should probably work on your cardiology, and you can do that really easily with UWorld, because you can log in, set your questions cardiology, and do those. And the explanations for UWorld are great. I mean, most of you probably have experience with it, just using it for step 1, 2, and 3. The second option to study is to use a book. Some people just like having, you know, if they're a little more old-fashioned, or they just like having something physical in their hands to read through and write on, or they like to kind of go through a topic in the book and then do the correlated questions on UWorld. That's fine. I have here 2 books. One of them is just first aid. Hopefully y'all can see it, but it's first aid for the family medicine boards. This one, you just find it on Amazon. I think it was like 40, 50 bucks. But it's your typical first aid format. You're used to it. It's great. Another one that I would recommend is this one. It's Graeber and Wilbur's. This one has pretty good question sets, and it's very structured. So you can learn about, I don't know, heart murmurs, and then do some questions about heart murmurs, and then go to UWorld and do heart murmurs. And by the end of it, you'll be a master at heart murmurs. So those are the 2 books I'd recommend. You definitely want to have like a longitudinal plan. So what I mean by that is, at the end of your first year, you should look at your ITE and say, okay, these are the things I need to work on. Here's the resources I'm going to use, and then just get started. That's the best thing you can do, is just get started. Of course, you know, we're here at Med School Tutors. We're happy to work with you if you need it. So this is just a quick slide about how to use your in-training exam scores as a guide. I kind of already mentioned it, but you go to theabfm.org. You download, there's a score report that you have to log in to download, and then it's a customized one with like a PIN number and stuff that they email you. So like only you can access it. It's very private, but I guess with test scores, that makes sense. You definitely want to download that, and again, just see what your strengths are, what your weaknesses are. Not only that, but also you want to take note of how each topic is weighted on the exam. So if you're really strong in, I don't know, if you're really strong in like male reproductive, but really weak in biostats, you really should be focusing in biostats because it's probably a higher percentage on the exam. So there will be more questions than that, if that makes sense. And this is just kind of a general timeline. So this is for residents who are currently in residency. If you're a first year, you want to kind of learn medicine and acknowledge any red flags. Any red flags might be, oh, I know I'm not a good test taker. I, second guess myself a lot, or, maybe I had to take step 1 or step 2 a couple of times. And, I just get really anxious when it comes to tests. So these are things that you can work on. We're happy to help you, definitely. In second year, you want to use that study plan and really focus and tune into those gaps in knowledge. So again, I'm going to keep using the same example, but if you're really weak in one area, like pulmonology, and that's going to be at least like 10% of your test, you really should be focusing on that and try to get in on the pulmonology cases, So if you see patients on wards that have pneumonia or that have lung cancer or COPD, things like that, you want to kind of use everything you can to your advantage to study, because ultimately this is the test you need to pass to get board certified and to graduate residency. And then your last year, stick to the plan. Your last ITE in October of your PGY 3 year should be a very, very good benchmark. There is again, on the abfm.com or .org, there's a tool called the Bayesian predictor, which lets you put in, and again, hopefully I'll get to share in the Q&A, but it lets you put in your previous step 1, step 2, step 3 score, as well as your ITEs in the past, and then it predicts how successful you will be in passing your boards. And usually I'd say it's pretty accurate. So if that's giving you, I would say, under 70% chance of passing the board or 80% chance, I would say maybe you're in some trouble and you need to really buckle down and focus and come up with a strategy so that it goes up to 90, 95%. The best thing to do, in my opinion, and in my experience with students, is to just do a crap ton of questions, and I mean a lot. I would probably say at least 2,000, 2,500, and you can easily get to that goal. The AAFP questions, the free ones, there's at least, I think, 1,300 of those, and then UWorld, there's 1,000 plus of those. So if you just do those two resources, that's already, you should already be at your goal. But remember, you have your old ITEs that you're going through, and every year, once the ITE comes out with the explanations and the scores, you can go through those explanations to see what you missed. Another good tip is that a lot of those questions, I wouldn't say a lot, but some of those questions are definitely reused or paraphrased. So definitely take advantage of that. And because you may see a question in your intern year and then get it again on your boards. You just never know. And the only way to take advantage of it is kind of know it in and out and do it a bunch. So that way, when you see it, you can be like, oh, boom, it's C, and be done with it. This is just a brief slide for some high yield topics over that the ABFM exam tests over. You definitely want to know your USPSTF, which is United States Preventative Task Force screening guidelines. So when to screen for colon cancer, it should be 50. But, what if they have siblings or parents with colon cancer? Then it should be, 10 years prior to the earliest that person got it. So if someone got it at the age of 50, now you're screening them at 40, things like that. You definitely want to know these, as well as vaccine guidelines, like the back of your hand. These are always tested, guaranteed, and they're easy points. You need to memorize the number, and you're often doing these in your clinic anyways, in your outpatient clinic, if because most residencies will practice, hopefully, evidence-based medicine. And so you'll get real life practice of this, and then it will definitely be tested. Some other things for cardiovascular, so definitely blood pressure management. Y'all are managing this in clinic. It shouldn't be too much of an issue. The one thing that maybe you don't see as much of is ACS. So what to do if patient is currently having acute cardiac episodes. You need to be able to triage them and say, like, okay, this is not something I can handle in clinic. You got to send them to the ER, and what do you have to do for them while they're on the way? Some other things, definitely diabetes, thyroid, these always come up. For infectious disease, antibiotics, stewardship. So if they're coming in, maybe it's a parent coming in and their kid has been sick and now they have a scratchy throat. It's probably viral. You probably don't need to do prescribe antibiotics. So that's antibiotic stewardship. Some other things, a little bit of OB, some peds sprinkled in. Usually it's very common pediatric infections. So I know most people rotating in family medicine, they'll rotate through peds. And some of the, I would say more difficult pediatric or more nuanced pediatric things you won't see on the family medicine boards. But here you'll see ear infections, conjunctivitis, Kawasaki's, all these things, common things that will be tested. And then, of course, don't forget the ethics and biostats questions. This is a link below. I'm not sure if this PowerPoint will be emailed out or will be anywhere, but the link below, you can just Google it, and it'll have some of the things we talked about in terms of high yield topics, what resources to use, and the timeline will all be there. This slide we kind of already mentioned, so I'm just going to glaze over it. But basically, you know yourself best. You already made it this far in your career. And so you know what red flags that you need to look out for and that you need to prepare for. We talked about the Bayesian predictor. And, if you're really mentioning, oh, there we go. Thank you, Faith. There's the link she just posted. So you can take a look at that after. Some other things to kind of notice is that if your peers are really at a certain level and you feel like you're not there, that could be a red flag. So for instance, your attendings or your peers or your upper levels are talking about this journal article and you're really not sure what's going on. Maybe it's just that article, but if you notice this happening, week after week in didactics or month after month, then maybe you're a little bit more behind and maybe you need to kind of do a little bit more focus in studying or reading or whatever you need to do. Again, you're in residency, you've made it this far, you know what red flags to look out for. These are just some reminders. The last thing on here is, so at least at my program at Baylor, we had, I think, semi-annual, so twice a year meetings with our PD, and he would kind of just go over with us, oh, you're doing this well, you're not doing this well, or this needs work. So that's something to take note of. Some common pitfalls, things to avoid. Don't wait till your last year or two to study. Just do a few questions here or there. Not only does it help with the knowledge gaps, but it also builds a good habit. It's really hard to go from 0 to 60 your last year and ramp up from doing no questions and relaxing after coming back from clinic to suddenly doing 50 questions, because that's how many you need to do to get through it. It's much better to start with 10 or 20 every week and then ramp up to 30, 40, 50, 60, kind of a gradual ramp up like that. And if you do it that way, you'll have already done a bunch of questions and you'll be used to it. A lot of days, I understand that it sucks. If you're on inpatient, you're working 6 days a week, nobody wants to come home to do questions. Maybe you can do some questions while you're in the hospital or on your commute or something like that. Some other pitfalls, you don't want to take the ITE lightly. The first year is kind of a caveat. Your first year, it's October, you've been a resident for 2 months, you're barely learning Epic or whatever EMR you're using, you're learning how to work in a team, you're learning how to finish your notes so you can go home on time. Totally understand, I've been there pretty recently. So, but your second and third year ITEs are the best resource that you have. Those questions really, really mirror the questions that you'll get on your board exam. And so you want to really use that as a benchmark. So you want to study hard for it, do your best, and really give it the old college try, see how you do. And if you do fine, great. Keep at it, and you'll likely do fine on your boards. And if you find that, oh man, my IT really wasn't good and my Bayesian predictor score is like 50% and I'm really struggling, well, then at least you know that, and at least you know that you're struggling on your ITE, and maybe you quote unquote failed your ITE or didn't meet your expectations, but you still have time to work at it until the boards. One other thing is, again, there's a wealth of resources, which is great, but also it can be overwhelming. You can get what's called like analysis paralysis, where you're literally just spending days and days picking out, oh, which resource is better. Maybe this book is a little bit cheaper, or that question bank has 50 more questions. At the end of the day, who cares? Pick a couple and stick with it and just get started, rather than waiting and thinking, oh, if I use this resource, maybe I'll have like a 2% higher chance. Something else, definitely pace yourself. Don't be too hard on yourself. Taking time to study in residency is really hard. You'll get easier days, take advantage of those days, give yourself a break. There are some rules that I'll go over later on. But basically it's like, if you have a golden weekend and you want to go do a trip to Vegas or something, go for it. You don't need to be studying every weekend. That's not what I'm saying here. Especially if you get started early, then you'll have a lot of time off, okay? All right, so some things to kind of help with that and help you plan ahead. This is just a plan for those in residency who's starting PGY1. If you're already a PGY2, 3, maybe the next slide would be more helpful. The first thing to know is, again, knowledge is power. How much you know, and more importantly, how much you don't know is going to be very important. So the point is to work on things that you're weak in, work on things that you don't know, rather than if you're really, again, really strong in like female reproductive and you're just only studying that. Because I get it, you want to study, you want to work at what you're good at. But I think in terms of this test and most tests, it's more important to work at what you're not good at. You want to make a calendar. I don't know if you guys remember doing a calendar for step one. I think I did, but it ended up being pretty rough. And I don't even know if I got through all my questions, but you want to make a calendar. So maybe by your first month, you'll have done, 50 practice questions, something like that, and just ramp up. Again, this is more of individualistic. So you know yourself best, you know how many questions you can handle. I wouldn't start with, 100 questions a day. That's kind of unreasonable, and you'll run out of questions for sure. And you want to kind of correlate this with your residency schedule. So maybe the first couple of months are really tough because you're just starting out, and maybe you have inpatient and then inpatient peds and then inpatient OB, like 3 rough months. Maybe you don't do any studying then. You don't want to burn out. And then lastly, definitely save some money to purchase your study materials. UWorld is pretty expensive. The books are like $50. Again, AAFP is free, so that's great. Your ITEs are also free, so that's great. So just UWorld, a few $100, and then the books if you want them. This is the second slide. Something also useful is talking to your co-residents, and really underutilized resource, I think, are your upper levels, and even current attendings or fellows at the program, but definitely your upper levels, because they're literally you, but a year or two in the future, So definitely talk to them, hey, what are you studying, or what are you using, or how are you preparing for the boards? Just a simple question like that. And, maybe don't do this for an icebreaker or something. Get to know them a little bit first. But yeah, I think it's a pretty casual, harmless question that you can ask, and I'm sure they'll be able to help you. This is what I was kind of talking about, the treat yourself. So vacation is definitely a rarity in residency. We work a lot of hours. No studying on vacation, I totally get it. Don't take a vacation just to study. Go have fun, go enjoy yourselves. Use your every day to study if you need to. These are just some rules I made for myself. I didn't really study too much on words. And then I made sure to enjoy my Goldens. I actually was talking to one of my friends, this was a few months ago, and I was telling him, like, I was excited I had a Golden. He was like, what's that? I was like, yeah, it's when I get, Saturday off and Sunday off. He's like, no, that's just a regular weekend, man. People not in medicine, they just don't get it. Goldens are awesome. And especially intern year, you don't get too many of them. So take advantage. Some of the resources, some of them I've already talked about. I'll just go ahead and highlight them. Your first year, your AAFP, again, these are free. So it's kind of like a no risk, only benefit thing. You log in, and you should have a login already from residency, because this is how you access all the Academy of Family Physicians, like journal articles and all that. But you log in, you do a few sets a week, 10 questions, 20 questions a week. You get started with that. The ABFM, these are the knowledge self-assessments, the KSAs. Again, they're not as good, so maybe come to these later on. Your second year, you're still doing those AAFP questions. Again, there's over 1,000 of them, so maybe now you're doing 20 to 30 a week. I know that AAFP, and there's like, what are all the resources? Like Med Crammers, and there's like Sketchy. There's a lot of videos. You can use those, watch those if you want. For me and my students, I don't generally recommend it unless someone really likes watching a video or listening to a podcast. Then that's fine. By all means, go for it. Second year, I would say go ahead and purchase UWorld. They have like a 6-month option or a 12-month option. I think it's like $349 versus $449. Get whichever one you think fits you. Start doing those questions again, because those you can kind of tailor to what you're strong in, what you're weak in. And then your last year, really study hard for that ITE. After you take your third ITE, I think the scores come out by the end of like your third year. So they come out by like December or something, before April, before your boards. So really go over all 3 ITEs, your ITE first year, your ITE second year, and your ITE third year. Really know those questions in and out, because there might be some repeats or paraphrases of repeats. And then those, again, mirror the questions best, and the explanations are the best. They're just overall great, and they're free. So you want to finish up UWorld in your third year. You want to go through those ITs right before the exam. This is also the time when you want to, this or before, when you want to consider any review courses. If you know your stuff, you're like, oh, I really just need someone to kind of help with my anxiety or help with strategizing or developing like a study plan. You can go for it then. And again, I have ITs listed on here twice because they're just that important. I mean, I should probably put it a third and a fourth time. So yeah, those are great. This we kind of talked about in the beginning. One sec, John. We can talk about that in just a minute. For the board exam, we kind of talked about this. You get the 100 minutes of full break time, which is great. Because if you need to go to the bathroom, you go to the bathroom, you take a 2-minute break, and that doesn't count as like one of your break sessions or whatever. You can use the 100 minutes however much you want. You don't have to use all of them. So I think if you use all of them with the exam, you start at 5 or you start at 8, and maybe your exam ends at like 3:30. If you don't need that much break time, you can end it at like 2:30 and go get brunch or whatever. So the pooled break time is definitely great. Once you finish a section, however, so it's 4 sections of 75. Once you finish a section, you can't go back. That's the only thing to know. And the last thing is the multiple choice question. In my experience, have all been, in my experience and all the other residents and students that I've worked with, it's been 5 answer choices. So it's not like, they give you a vignette and you have to pick like 20 answer choices, A through M or something. No, it's usually just 5. So that's really useful because one big strategy is to eliminate things. And usually on the test, I always eliminate things that I've like never heard of, because that by the time you're taking the exam, you'll have learned so many things. And family medicine, I know, is super broad. You have kids, you have OB, you have old people, geriatrics, you have newborns, you have just regular adults, you have everything on there. And it's a lot of crap, really, it's a lot of stuff. But, at this point in your training, when you're taking it, you should have heard of a lot of things. So if there's something you haven't heard of, I usually just immediately cross it out. So when there's only 5 to cross out, you can really significantly increase your chances rather than, if there's like 10 answer choices or something. All right. So the last few slides I have are just a couple of practice questions. I'm going to just go ahead and read it and go through it and just kind of give you a thought process. But before I do that, I'll give you just a few seconds to kind of look at it and answer it. If you want to type your answer in the chat, go for it. Okay, so 42-year-old female comes, and I'm just reading this how I would read it. I paraphrase a lot of stuff in my head. I skip some words. I try to get through all the important words, but 42-year-old female comes after being treated for recurrent respiratory problems at urgent care. Let's see. She felt a little bit better after a short course of steroids and albuterol, but it sounds like she's been getting worse, chronic cough and decrease in activity over the past year. So just off the top of my head, I noticed a few things. One, this person is young to develop any kind of chronic lung issues. It's been going on for a year. She hasn't really gotten better with the steroids. So these are just things that speak out to me. She brought an x-ray that shows panlobular, so this is a keyword, panlobular emphysema. No history of smoking. That's another thing that stands out. So they're young, they seem to have a healthy lifestyle in that they don't smoke. They don't even have secondhand exposure or occupational exposure. Great. And then spirometry shows this. So this is obstructive. So which of the following is the most likely cause? Yeah, so I think that's right. So bronchiectasis would show other stuff on the chest x-ray like dilated bronchioles, diffuse panbronchiolitis. First of all, I haven't really heard of these as much as I've heard of the other ones, so this really wasn't on my mind. Interstitial lung disease is more of a restrictive pattern, not obstructive. And then heart failure on chest x-ray, it would have showed like an enlarged heart, things like that. Yeah, so you guys, John and Jaspinder, you guys are definitely right. It's A. This is something I think of. It's A1AT deficiency in young people who have kind of like obstructive lung findings like COPD. However, they've never smoked a day in their life, no secondhand exposure or anything like that. And this is kind of what the explanation. This is a free practice question you can get from AAFP. So this again just kind of emphasizes the quality of questions you can get for free from AAFP. Again, the only real downside is that you can't filter out like poem questions versus endocrine questions versus PEDS questions or anything like that, where you can do that on UWorld, but you have to pay for UWorld, so no free lunch, I guess. Let's go. Oh, and then this is kind of a chart. So her FEV1 over FVC was low, indicative of obstructive. Some of the other ones were restrictive. This is just a chart I found online, so that's good to know. This is actually pretty much, you can almost guarantee that this will be tested, whether it's this, COPD, asthma, or restrictive like ILD or anything like that. Knowing this chart will definitely get you some points. And I appreciate you guys answering. It's always hard to get participation, on Zoom. So definitely appreciate that. Practice question number 2, I'll give you guys a quick minute and then I'll go ahead and read it and kind of go through my thought process. So a little bit of a different question. You see, for family medicine, you got to be able to just like switch just like that, going from like a regular adult to peds to OB. It's crazy. Anyways, so here a 4-year-old. So this is a kiddo, history of constipation over the past few months. So again, kid constipation. This is chronic, right? Not just like a day or two or a week or two. So mom says that she has 1 or 2 bowel movements, small lumps of hard stool. So this doesn't sound like it's a red flag. There's no blood or anything. She strains and they're painful, and she eats normally. So that's really good. It's not like she's so blocked up that she's having like abdominal fullness where she's not eating. So she still eats. And usually when they're this young, I don't really think of psych components. So let's say they're a little bit older, like 7, 8, or even 12, then maybe there's some like oncopresis where they're like purposely holding it in to avoid something or something like that. But anyways, a young kid, this to me is functional constipation. And I think what they're testing for in this question is what is safe to give. What is safe to give in pediatric patients with constipation? Generally, so at Baylor, I work at Texas Children's Hospital. Anyone with constipation who's a kid coming in at TCH, we give Miralax. Miralax is very safe, especially for functional constipation, something that can help. And it says what's most effective at this time would be Miralax. So I didn't have it up here, the answer choice, but it says, yeah, so functional constipation. And of course, I'm definitely, biased or whatever. I put these questions up here. I've definitely seen these questions. So don't feel bad if you got it wrong or anything like that. But so Miralax is very effective, more effective than all these. And also it's very, very safe. Low dose you can be given the low dose of Miralax every day. So that's just something good to know. That's just a little taste of the AAFP questions. You guys are welcome to go ahead and make a login. I expect you all to do 20 questions by the end of tonight. No, I'm just kidding. You can do them at your own time, but here's just to say they're good questions, and they'll definitely help you succeed for your board exam. So this is kind of a little slide about us at Med School Tutors. We definitely want to help you achieve your best results. Again, I've been saying, Med School Tutors, excuse me, has been doing this for over 15 years. It's one-on-one tutoring. Everything is custom just to you. It's not like I'm out here making one study plan to everybody. No, we would chat about it. We can make a study plan, tailor it to your schedule. We can literally go over some things that my team and I do. And in my experience with the students that I work with, we'll go over what rotations they have, maybe some easy rotations. They'll say, okay, you have some more time here. It looks like you can do some more studying there. And then maybe the next month you're on board, maybe you take it easy, lay off a little bit, things like that. So that's the custom schedule. There's adaptive tutoring sessions. I'm very flexible tutoring. I can meet on most days and pretty much all evenings and weekends. There's regular communications. So for my team and for me and my students, we usually email back and forth constantly whenever they need to. And a lot of them, it's just easier to do text. So, feel free to text me. There's definitely, and we follow you. We kind of follow you throughout your career. So it's not like, oh, we just do a few sessions and then you're done. No, we'd like to hear from you, where you end up working, how you do on your exam. Of course, we also offer some other extemporary tutoring, things like that. All right, and then so that's pretty much it for this webinar. Hope you guys enjoyed it. Hope you guys found something useful. Let me go ahead and scroll up to, I think there were a couple of questions in the chat. John, you mentioned, how do I choose you to be my med school tutor? So I think Faith, who's helping me on this, she kind of answered your question, but when you do the phone consult, you can go ahead and say, I want a tutor. I'm going to be taking the family medicine boards. And I met this tutor through the webinar. I thought he did a good job, or I thought he did just an okay job, and I kind of want to work with him. And you can go ahead and request me that way. Let me see what other questions there are. I think that's it. The rest were just answer choices, correct? Perfect. All right. So just last bit of advice, take it easy. Residency is hard. I'm a big proponent of residency wellness. My last year, I finished my chief year of residency just a few months ago, and you definitely, I've seen maybe some borderline burnout. You definitely don't want to get burned out. So that's why kind of throughout this whole webinar, I've been saying, get started early. That way you don't feel like you're behind your classmates. And you know yourself best. So if you need to be doing 10 questions a day in the beginning, fine. If you need to do 10 questions a week, fine. Just go ahead and get started. But yeah, that's pretty much it. Good luck to all of you guys, and have a good night. I'll see y'all later.